So, of course, there is an important part here, which is detoxification. And not all detoxification is the same, of course. People kind of lump that together as infrared sauna, you mean? No, not just that, of course.
Juice in the morning.
Right. Celery juice.
Yeah, exactly. Which is great.
Yes. We're not knocking that at all. But nevertheless, there is a detoxification component. With any detoxification, especially if you're going through a heavy detoxification, there is possibility for a Herx reaction.
Right.
And a lot of patients don't know too much about that or are ill-informed about that. Could you go into a little bit, especially if you're speaking to a patient that has experienced some symptoms or doesn't know what a Herxheimer reaction is? Can you go into that a little bit?
Yeah, for sure. So I think that the word Herxheimer reaction, I feel like that gets thrown around a lot in particularly in alternative medicine and whatnot, in the integrative world. And I remember using that phrase all the time at my first job. I worked at an alternative medicine clinic, and I blamed everything on that. I gave you a diflucan to help your yeast overgrowth, and you're feeling terrible. It's die off. It's a Herx. It's a Herxheimer.
You're good.
Yeah, you're going to be fine. So I think I was just naive because I had maybe one lesson on that in PA school, like Herx, and I don't remember. It was probably on my board exam or something. But anyway, a true Herxheimer reaction is actually life-threatening.
Yes.
You're talking, so it can put you into a SIRS, so a systemic inflammatory response syndrome that can literally kill you and put you in the hospital. You become hypotensive. That's something that you see in the ER, that we see in the ER in septic patients. Or I did see in the ER, sorry. So basically a Herxheimer reaction it was originally coined, I think, due to patients who were being treated for syphilis. I think that's what it was. But it's when you give a heavy dose of antibiotics to a patient who has whatever infection, syphilis, Lyme disease, and you kill all of those bacteria. Well, those bacteria release toxins and they explode essentially. And so you've got dead bacteria, debris, toxins, all of these things floating around. Well, sometimes that can overload the system, and your immune system is like, what the heck is going on? And it starts doing damage to your organs, and they start shutting down, and then you can die. So it's a very, very serious thing. Yeah. So, and you do have to be careful in treating people who have a very serious infection, like just dumping antibiotics, not even just antibiotics, even natural treatment at them, because you don't want to do that to them, obviously. And so I think the key there is detoxification, cleaning house before you treat whatever infection there is, so that you don't throw them into a Herxheimer reaction. They don't feel absolutely terrible. Because if you don't, get the lymphatic system functioning well again, get the guts, functioning decently well again, get the liver up and going, have the kidneys flushing well. If those things aren't working well, and then you just kill a bunch of bugs, bad stuff happens. But so most of the time, I think when patients come here and they have, say we give them antimicrobial to help with Lyme, and they feel poorly afterwards, that's not a true Herxheimer reaction, because you're not hypotensive and in the ER, but it is a more of a, like, you do have some extra toxins floating around. And so it's kind of a detox thing where your body needs to get rid of all of that stuff, but it's just getting a little backed up. It's not the end of the world. It's okay, but it's not a Herx.
Right. And thank you for clearing that up, because I used to toss that word around too. It's like, you got a little bit of a headache, fatigue, Herx. Don't worry about it. Like, you're just Herxing.
You're
right?
fine.
But I was schooled also into understanding it's a very serious condition, right? And that's not what you're experiencing if you're symptomatic after a little bit of a detox regimen.
Oh, yeah.
That's natural almost. And again, I understand in Europe, the doctors look for that. They say, it's working. We're getting some effect, right? You want to cause an effect. And when you're removing things out, again, there's some pain in the change of it. It's like changing a diet. If you're eating very poorly and go straight into only greens, you may have some abdominal discomfort at first, even though that's healthy for you. The change is so sudden that you're not used to it, right? And things are actually starting to work properly in some ways, but it's still a change, and you're experiencing those changing parts to it. So,
definitely.